I would like to introduce our third speaker for this afternoon, David Dahm. David is a chartered accountant and is the CEO and founder of Health and Life, which is a national chartered accounting firm that provides advisory, tax and accounting services to the healthcare industry. David's qualifications as a chartered accountant include being a Fellow of CPA Australia, a Fellow of the Financial Services Institute of Australia, a Fellow of the Taxation Institute of Australia, a Fellow of the Australian Association of Practice Managers in Healthcare, a Certified Practice Manager, oh come on, a Fellow of the Australian Institute of Management, a Fellow of the, I have to. He's obviously a very clever man, and I welcome David to the stage.
I've actually been in the healthcare industry for now this is my 25th year. And I've worked at all different levels. And yeah, look, the CV's there in case anybody missed anything that was said. But I've worked at all different levels. Predominantly 80% of my clients are primary care, particularly in general practice, but hospitals, public hospitals, work with federal and state governments. And I've also been involved in national primary care collaboratives. And in addition to that, there's a few things I do in the media. I'm an Australian doctor and medical observer. Some of you might have heard of me from there. And my parents and my in-laws are all doctors. So I'm a reject, basically. Okay. So this is the beginning of my journey and why I'm in healthcare. You know, you all got to have a why. This is my why. I actually wanted to be on Wall Street. That was my big ambition when I became an accountant. And then I didn't have this work-life balance thing worked out. This is what I did to myself at 5:30 in the morning back in I think it was 89 it was, in July. And I fell asleep at the wheel at 5:30 in the morning from fatigue on a Tuesday night, crashed my car into a tree, and copped myself about 9 operations. At the time, I was quite frustrated as a patient about the healthcare system. It wasn't the doctors, it wasn't the hospitals, just how everything worked. It just didn't feel like it was working. And I became, effectively, I said, what's the point of being the richest person in the world if you're going to be 6 foot under? And I really set out to and this became my new mission. Instead of wanting to work on Wall Street, I now wanted to work for the man on the street, focusing on one core thing, creating a socially responsible and sustainable healthcare system. And this is my journey. And 25 years later, I'm winding back the clock. And this is what I've seen just out in the field, working with people like yourselves. I was asked, I don't know if you've heard of Charlie Teo, the neurosurgeon. Well, he approached me to talk about, well, I didn't know at the time, it was a conference about bullying of nurses, doctors and patients, and APRA. It was pretty controversial. And I was the last person to speak. And they said, David Dahm's going to fix this problem. I said, hell, that was a big call. I was quite traumatised, I'll be quite honest, to hear the other side of healthcare that wasn't brought to my attention until that particular conference in May. And when I was doing the conference paper at the time, I was doing some background research, and the third biggest killer of human life, it's not heart attacks and it's not cancer, it's errors in the healthcare system. In America, 250,000 people die from errors in the healthcare system. That's equivalent to an A380 jumbo jet crashing every day. And this has actually come out of research from the Johns Hopkins University in 2016. It was published this year. In Australia, it's 15,000. That's 50,000, and there's another 50,000 that are permanently injured from what could argue potentially avoidable errors. Now, I have got no problems about research into cancer, into heart risk, but boy, if we can actually prevent things that us humans have created, surely that's a good target and attention we have. The only problem is this is not sexy unless it's a plane crashing out of the sky. Well, one crashes every 10 days here in Australia. And we want to talk about road accidents that we see on the 6 o'clock news. Guess what? That's only like 1,500. We've got 15,000 here. But this is totally unseen. Okay? This is how you fix it. In my research, and I did a lot of research and a few PhDs and professors have backed me with this research, so this is not all my work. What we don't have in this world is an international healthcare standards and ethics board, a centralised system where we've got patient incident reporting like they have in the airline system, you know, When a plane's got a problem on the tarmac and it's with the wheel, there's an email that goes out to every make and model of that plane across the world. Quick, check the wheels before the next plane takes off. We don't have that. Yet there is actually an international e-health system, which I found, but we don't use that. So, and it's not expensive, this exists. We're not talking about reinventing the wheel, we're talking about coordinating this better. The other thing that I've found, much to my surprise, and I'll be backing up my proof with evidence, because evidence is very important, that there are no commonly agreed clinical standards that are peer-reviewed, let alone enforced, by the medical or the healthcare professions in the world. Period. Despite all the evidence, and there's a lot of good evidence, but there is not a common peer review process. And as a consequence, we see duplication and wastage. So every time you ring up Medicare and all that, you get 4 different answers to the same problem. This is why. Okay? We've got some fundamental frameworks missing. There's a lack of context. The other thing that concerned me the most, that practitioners, when there are complaints that happen, and by the way, complaints are up an all-time high in Victoria and the Aged, only a couple of days ago, it's up by 28%. And as you know, it's complex with patient complaints. Sometimes it's a mental health problem. You can be prosecuted without evidence. And I'll prove that to you. But here's the opportunity for Australia, and this is why I need everyone's backing. And please tell please tell the AAPM directors, please give this feedback. We have a huge opportunity to grab this piece of real estate that nobody's really interested in the world, to establish this board here in Australia, like we have in Geneva, the World Health Organization, because there is no organisation that has this responsibility. And we can attract the best minds in research and teaching and promulgation of clinical information and best practice in the world if we take this opportunity now. And I'll tell you why. This is how I found out this particular problem. When I started out consultancy, I wanted to become a practice management consultant. And I went out there to my first marquee client and I put out a suggestion box, because that's the best way to find out whether your client's meeting the expectations of their patients. In the first week, I had it under lock and key, and I actually got around about over 10 complaints over the same doctor for inappropriate treatment of female patients. I was in an ethical dilemma, and I thought, gee, I'm going to get sacked before I've started. Okay, and it actually happened to be one of the partners and owners of the practice, a major one. Pretty complicated stuff. Went to the chair said, listen, David, we don't know how to deal with this. I said, what? Can you handle it? I said, I'm your accountant, your business advisor. I can't talk on these sorts of things. That's not my job. It's to just show them the forms, make himself aware. And by the way, I went 40 grand for a chaperone. But I did one other thing, which I thought I would have got practice manager of the year or consultant of the year. I went and actually read the forms, and what I actually said was I wanted to give women what they wanted, and they wanted a female doctor. Pretty simple, huh? Let the free market reign. So I went there and I advertised for a Tears and Smears clinic doctor, and I got one. That's hard enough to get those. We set one up, and guess what happened next? 6 months later, we get a call from Medicare for over-servicing too many pap smears. Okay, yeah, you're telling me, I'm thinking, hell, that could be my wife, my daughter, somebody's girlfriend, and this is going on. So I was speaking to the Medicare office. I said, how do you do this? Oh, that normal distribution curve, David. What are you, a bunch of accountants? Have you even spoken to the doctor? Have you spoken to the patients? No, we haven't. I'm sorry, they're an outlier. All the male doctors are sitting here only doing 4 a day, and this guy, she's sitting out here. I said, well, hang on, don't you profile? No, we don't. I said, well, what sort of evidence is that? Well, David, if you want to take this further, roll over, just pay back the money, go quietly, and we won't make this difficult. Next minute, I'm the most dodgiest advisor of all time. Practices losing confidence in my abilities. I'm feeling, hang on, what have I done here? Anyway, I got a bit excited about that little thing, and people who know me, it's a bit hard to keep me quiet. And I wrote a little article in Medical Observer saying, what is does the government, I don't know if anybody's from government here, can interfere in the doctor-patient relationship? And I actually had a High Court judge who established that they couldn't. So, there's a constitutional issue here. Because why are they interfering in this? That's where my taxpayers' money's going, and I think this is total abuse of the taxpayers' money on that basis alone. It means you can't innovate, so let's forget this session, because we don't fit this statistical narrative that exists. And I went further and I asked, well, what is this evidence? And in fact, I got so passionate about the whole issue, there was a group of doctors, and we actually ran against the Professional Services Review in 2011, ran in front of 7 senators who testified on this particular issue about illegal prosecutions of doctors. Where's the evidence? Now, I don't condone over-servicing, but what I do want to see is what is that evidence? Is it just an opinion, hearsay? What is the basis? Anyway, story is that there wasn't any evidence and all 177 cases got suspended. But here's the thing here. This is the APRA Act that all of you, that if you're a nurse, if you're a doctor, if you're in allied health, says, and this is in every state, it says that a panel must observe the principles of natural justice, which all of us are entitled to as civilians, but not if you're under APRA. So you can get prosecuted without evidence. Okay. So there you go, it's sitting up there for you. Take a look at it. Yes? Bound by the rules. Yes. Well, okay, I stand and I accept that correction and I appreciate that. But evidence is the key, and the prosecutions that we've seen in a number of the cases that were won, this was into question about the PSR's activities at the time, which actually caused the problem. You agree with that? Okay. But I'm just making the point as simply as I can, so everybody can understand. A year later, Professor Bill Runciman, who actually has done research for the National Medical Research Council, actually came out with a study which actually said that we don't have commonly agreed peer-reviewed clinical standards in Australia. Now, he's probably one of the most cited, I think it was in 100 years, professors in the Medical Journal of Australia on this point. And we got a letter of support from him on exactly the assumption one had taken. Okay. On a positive side, are we that bad? No. We've been looking at the international research about quality in healthcare practice. And in fact, if you actually look at where Australia sits, we're not too bad on the leaderboard. We get probably the most ticks. And in fact, we're the only country in the world, I mean, we're equal with Canada, but we get the most ticks from the point of view that we're the only sustainable model in the world. So we're not that bad, despite what might look terrible. So there's some significant opportunities when you think about that. All we're trying to do is make things a little bit better than what they are. How do you fix that problem? By establishing an international healthcare standards and ethics board, you have then an opportunity to help professional bodies develop their standards and ethics, promulgate that information, ensure compliance, teaching, research, medical devices, making sure everybody's using the same sorts of medical record, like all the medical records are a certain format, so you've got interoperability. It's a bit like creating a Windows system that everybody's got a central way of building and developing these great ideas that we see that we can implement. And the professional bodies actually can help in making sure that compliance happens at a practical level, talking to the computer companies and getting that data and that information in a way that makes it easier to implement in practice. Okay. And this is a self-funded model, by the way. This is not asking for Commonwealth money. Okay, we're not asking for that. We're asking for all professional associations and their members to support it, because self-regulation is much better than actually being regulated, because the profession has skin in the game, the patient's in there, and it's a lot quicker response you can get. And we're also looking at the consumers at the very top of this scale here. Where does the consumers sit? So the consumers and the funding models are all part and parcel of how these standards are actually developed. What are the best, internationally best sustainable models in the world is a good starting point. That's what we're trying to achieve here. How do we get all that information, centralise it, and let the world know quickly? Does it work? Is there a precedent? Yes, there is. I'm an accountant, and we've been doing this since 1966. We have international standards in the world, and it happened because of all the rorting and everything that was going on with the stock markets. That's why we have it. So it actually does work. And these standards and people say, oh, it's just numbers. No, it's actually quite sophisticated what we do. Our duty of care is to our clients, not to ourselves. We are professionals as well. We can't just think about the money and the profit. We have a community duty. If companies start collapsing, we've got global financial crisis and a whole range of issues. Now, there's reasons why those things happen, but it wasn't the accounting profession that's responsible for it. That was a banking problem. Here's a practical example. I got a call by a practice manager, and that particular practice manager was a joint owner with another doctor. in the practice. And that particular doctor was also, their group accountant was also a patient at the practice. It was a major conflict of interest. Now, in the medical model, all of that would have gone to lawyers and everything like that. Under this model, simply copied and pasted this section, and that group accountant resigned from that engagement. It took literally minutes. And that's how the accounting profession operates. It's very simple, it's very quick, and it's easy because it's in black and white. And it has a lot of practical stuff in there just to help people think through some of these issues and concerns. And this is equivalent to APRA, the Tax Agent Board. They actually adopt these standards. And they do that with the corporations law. You don't see it, know about it, but you will take it for granted, but there's a lot of work that goes in here. So APRA will still continue to exist. But this basically helps screen out a lot of those small problems, because sometimes the process is worse than the problem itself. And that's what we're trying to fix here. So what do we need to do? We need to create a framework that can be trusted. There's so many mobile devices out there and computer programs, but nobody knows whether that information that they're looking at can be trusted. What sort of vetting process is it going through? Is it best practice? Okay? And people can grab an article and say, hey, this was published by X, Y, and Z. There's a lot of information, but it's confusing, it's not easily accessible. So there is a way that that could be easily pre-vetted. Now, this could equally apply to pharmaceuticals and the like. So the reality is that people more and more are going to use these devices, and they're having a huge impact and influence on their care and the decisions they make. So we do actually need something like a Windows system to sort of integrate all this information that meets the professional standards of all the disciplines that exist, but also meets society's expectations. Because healthcare is not just about the kind of health you give, but it's also the research and how we actually can improve and develop. There's a lot of innovation I see. And for example, somebody like Hans Barnard Christensen, you know who he is? He was the first guy who did the heart-lung transplant in South Africa. If he was trying to do this today, he would be castigated for that research. So we can't stop innovation, but everybody has a subjective opinion on who's a cowboy and who's not. And unfortunately, you see from time to time, they use the medical board and all these other agencies as a reason to stop their competitor, and that is really hurting us all. Okay? But if we can do it in a very acceptable and peer-reviewed framework that is safe, this allows innovation to occur. It allows us to deal with the cowboys. So at the end of the day, trust is a must. You don't get it back once you lose it. It gives us that opportunity to do that. And more importantly, it empowers patients to make better decisions as much as providers. And it's done in a way, you don't see, how many accounts do you ever see on scandals in newspapers? Hardly anything. How many times do we read about a hospital, we read about a doctor, or read about, some scandal in the paper? It happens nearly every second or third day. We're reading about a new scandal. This is the only way I can see forward that can work, and I hope you can see that as well. And the reality is, what I'd like to see is that one day we could go and look at the 6 o'clock news, and as much as you can see, the reason why you see the stock exchange report, because that information is more trusted and seen as credible on the 6 o'clock news, as is the weather. But we should have something like a health value index or the traffic light report for individuals to help health literacy in these areas. And that is achievable if you have a centralised framework. So the benefits are quite huge. There's huge kudos for this country if we take this initiative. It would attract the best and brightest talents. It will attract huge investment as well. We just need to create that environment. It will provide public confidence and continued public confidence. And people will be paid and encouraged to do the right thing, per se. But some of the benefits really are reducing lawsuits, reducing disputes, and and there's a lot of opportunity. There's so many big people coming in to commoditise health, reducing that. And some people say from time to time there are political and vested interests in healthcare, which is what this is all about, keep everybody in the dark. And a bureaucrat once said to me, David, where there's confusion, there's opportunity. This changes that completely. It doesn't allow that to become part of the system. I've had letters of support from very preeminent professors, Paul Komozaros from the Royal Australian College of Physicians, who is now current adult physician national president, and researchers, and also from around the world. And we have those letters of support. What I would ask of you is that if you think there's even one bit of merit, Facebook like a fair go for patients on our Facebook page. Speak about this, share it with your friends, because if you don't do anything, I'm doing this pro bono. I've got nothing in it other than to raise the issue. Have a debate and a conversation is all I'm asking. But if you think it's worthwhile and you think it's important, all I'm asking is a Facebook like to say, hey, look, this is important. But what I do know, there's a lot of interest at the Commonwealth level, and I've been speaking to the Minister's Department, and they're very interested to see what we do. But one thing the Minister's Department said to me, we need to see how the profession responds. Because if the profession doesn't respond, what you're going to get is more regulation, and this is what happened to the accounting fraternity. They were told when we had the last corporate collapses in the 80s, and I was actually in one of those, when the big banks collapsed back in South Australia, and I was actually an internal auditor at the time, and we were basically threatened that if we did not self-regulate, we were going to be regulated. And all the competing bodies all came together and they said, well, the enemy is the government, we need to put our weapons down and work together. At the end of the day, I really believe in the free market and people being able to be free to choose and make decisions about what kind of healthcare we need, and also to allow freedom for innovation without fearing prosecution. This is the best way forward. I'd like you to discuss that with your families, with your friends, with your colleagues and your peers, and please support us. There's a whole paper and a dissertation, it would save a lot of money. So, in closing there, that's my acknowledgements to all the people that have helped me on this journey. I hope we can take it to the next level, and I thank you very much for your time and your attention.